Good afternoon. I'm Dr. Abu Bakr. Today with me Dr. Shantanu Tandon, HOD and Senior Consultant, Department of ENT, Sakra World Hospital. So today we have some questions from the patient side. We have to discuss about the hearing problems in children.
Sure. Good afternoon, everyone.
So sir, I will read the questions, so you can answer the questions.
Sure.
So first question, can you explain common signs and symptoms of hearing problems in children that the parents should be aware of?
Right. So, hearing problems in children really depends on what age group we're looking at. Now, if we divide children into newborns or infants who really can't convey anything, and then children who have already developed speech, who are 4 or 5 years of age and onwards. So, hearing loss in very young children, that means infants and newborns, is extremely important because there are no signs and symptoms that are very evident. So, what is it one should do? Well, as a rule, all children who are born in our center, and for that matter, most big hospitals, they will get tested for hearing problems. It's a screening test which we do. And otherwise, also, parents should be aware that there can sometimes be a problem in the ear, and if the child is responding to simple sounds, so simple sounds like a click or the sound of a parent calling from one side, and if the child is turning their head, the chances are that the hearing is okay. But as you grow older, children are capable of telling the fact that they have a problem. So often they will just ignore things which are being said, and that's not always because of a personality or of a lack of interest. But if parents do see something like this, then they should always understand. Also, infections are by and large the most common cause of hearing problems in youngsters. Either it's because of a cold or because of some other trauma, but if there is other symptoms, so for example, if there is pain, if there is some ear discharge, if there is a constant itching, then these are things that parents should look out for.
So, what are the main causes of hearing loss in children? And there are any preventable factors the parent should know about?
Right. So again, newborns, infants, and older children. Now, in newborns and infants, we don't really see a lot of infections. Trauma obviously can happen, but we always are concerned about any damage to the internal functioning of the ear, that means the nerves inside, and that can occur congenitally, that means by birth, and they can also occur post-viral. So you would have heard that after a viral infection, so-and-so person had a problem with sense of taste or sense of smell, and that's the nerve which got involved. Similarly, the nerve which is responsible for our hearing, that can also get involved, and this is post-viral, and that's something which we need to be aware of. So if a child has had high-grade fever, then post-fever we should always make sure that the child is hearing well. Now, what about the other children? So most parents would have come across children who have said, "Doc, my child had a cold, and after that he kept complaining of ear pain." Now, that's because of a very common problem which we call an acute otitis media. That means a blockage in the tube which connects the ear and the nose, called the eustachian tube, caused a collection of fluid which stretched the eardrum. Now, this collection of fluid can also cause a blocked feeling or a hearing loss, and that is often picked up by teachers. It may sometimes be picked up by parents, but the teachers often will say that he doesn't seem to be paying attention. Well, the child who's 5 years old doesn't seem to be paying attention because they can't hear what's going on and they don't know any better. So instead of saying something, they just start ignoring things.
So, how is hearing loss diagnosis in children, and what are the typical tests involved to check the hearing?
Right. So we talk about this all the time, that first and foremost, you should have a very high index of suspicion. The people who would have the highest index of suspicion are the people who live with the child, so the parents or the siblings. so that if they notice that something sounds wrong, they should not ignore it. They should not think, the child must be ignoring it. It should be something which is followed up. Okay, but again, depending on the age of the child, we would decide what kind of tests to do. So again, we'll work from youngsters. Newborns, infants, all children undergo a screening test called a OAE, or autoacoustic emission test. And that's a screening test which is done at birth. Before the age of 3 months is usually the norm. And sometimes if these tests come negative, that means if there is a problem which comes up on this test, then we would do a more methodical or a test which is called a BERA. Okay, now this is responsible for checking the electrical activity all the way from the starting of the hearing process, that is the inner ear, all the way up to the center for hearing in the brain or the cortex for hearing. And it can actually identify where the problem is. Now this sounds very complicated, but it's the only way to test such children. But when we move from, again, children to older children, we start looking for the actual responses to sounds. Now, older children above say 5, we can actually ask them to do something called a pure tone audiometry. We'll give them headphones, we'll put them in a soundproof room, we'll give them sounds that they have to hear, and whenever they hear the sound, they just put the finger up or they just press a button or a bell, and we know that the child heard it. Now the same test is done for adults, and that is very, very helpful. But sometimes we also do a test called an impedance audiometry, where we look for any pressure changes behind the eardrum, which is the most common cause of hearing loss in children. Now the problem arises when we are dealing with children between say 1 and 4 years of age, because those children, they're not easy to hold on to. They are not easy to convince that they need to get a test done, and often we need to do something a little bit more special. So there's something called play audiometry, and that is something where we associate some kind of a game with certain sounds. Okay, so, and there's something called an auditory response audiometry, and these are again situations where we connect a presence of a sound or acceptance of a sound to some treat. It could be a visual treat. So a visual response would be they show them a toy or show them something like that as soon as they hear a sound. So whenever a child responds, they know that they have to respond by doing something because they're looking forward to it.
So what are the treatment options for children with hearing problem, and how effective are they?
So again, there's a common theme over here: very young children and older children. So if you have a child who is very, very young and has shown signs of hearing loss, that means the child is not responding to commands, etc., you need to first confirm it. You get a BERA test done, you maybe repeat the BERA test. And if the test shows that there is a significant hearing loss, then often the only treatment at that point of time is the use of a hearing aid device. Now that sounds a bit scary to a lot of parents. One of the first responses that parents have is, oh my God, he's so young, how do we start using a hearing aid device? Truth be told, that is the safest way of making sure that a child or adult for that matter is hearing, because we're just amplifying the sound, and until we have a better grasp as to what caused it, at least the child is hearing. And this is important because if the child has not been hearing properly, the child will not develop their speech, etc. And this is a very important part. But if the problem is because of, say, an infection, either a short-term infection secondary to a cold, or a very long-term infection, for example, what we call a chronic otitis media, then we have to treat the root cause. Now the root cause could just be a cold. In that situation, we just give cold medications, and pediatricians and ENTs do it all the time. But sometimes if we find that there is a lot of fluid stuck inside, and we do that by doing a test over a period of time, then we need to make sure that the fluid can be taken out, and sometimes we will do a very minor, minimally invasive procedure known as a myringotomy, where we, under the microscope or with the help of a camera, go inside, make a small slit to release the pressure of the fluid, suck it all out, end of story. Sometimes, I would say in a very short group of patients, small group of patients, we will have a chronic infection, what we call chronic otitis media, and they may require a lot more complicated surgeries, and that's few and far between. But the gist of it is, treat infection, treat the cold, steam inhalation, maybe some nasal sprays which will also help open up the tube connecting the ear and the nose called the eustachian tube, and that will take care of hearing issues in a lot of youngsters with a infection.
Are there any specific lifestyle changes or recommendations that parents should consider for a child with hearing loss?
Right. So the only thing which is directly associated with lifestyle and hearing loss is if you're constantly exposed to loud sounds. So if you've got a 12-year-old who's constantly on headphones, constantly listening to loud music, don't let them do that. So that's something which is really important, and you need to make sure that they don't. But a lot of times there are other issues which are secondarily causing the hearing loss. So for example, if you've got a child with allergies who's constantly got a cold, so the cold is constantly causing a eustachian tube block, and the eustachian tube block is constantly causing a hearing loss. Treat the allergy. Try to identify what is it that is causing the allergy. So if it's a dust mite allergy, you need to learn how to clean the linen, clean the curtains, clean the pillows and the bed sheets. Make sure that that you've got a good pest control happening, because it could be a pest related allergy. So identify the root cause of the allergy and treat it. So that's largely what would be, from the lifestyle perspective, helpful.
So, sir, can you discuss the importance of early intervention for children with hearing loss and how it impacts their development?
So, one thing is for sure, you cannot sit on a problem where a child is unable to hear, especially a very young one. If you've got a 1-year-old child who doesn't seem to be catching up with things you are saying, doesn't seem to be turning towards you, is not responding well, and if the hearing test has shown that there is a hearing loss, doing nothing will be life-changing for the child. So you have to do something. Now that something will depend upon two things. What is the cause of the problem, and it will be how severe is the problem. Now the hearing test will tell us how severe the problem is, and if it is a nerve-related issue, then we have to start with a hearing aid, and in some cases that may also not be enough. Now, if we don't do something about it, what happens? So if I don't know how to speak, and I anyway cannot hear, there is no way I can learn ABCD. There's no way I can learn basic 1, 2, 3, 4 and maths. So who are these patients? These are the patients who will, if left like this, turn into what are loosely called the deaf and dumb. We call them deaf and dumb because dumb, they're not able to talk. And they don't talk not because they cannot, they don't talk because they never learned how to talk. So unless I learn my teacher saying something, I will not be able to do that. So that's one of the biggest problems which will impact the overall development of a child. So doing something is very, very important.
Yes, sir. How the parents differentiate between the temporary hearing loss, such as the infection, and more serious or long-term hearing problems in their children?
Right. So, infection-related hearing loss usually does not occur in a 1-year-old or a 2-year-old. They can have infections. They're usually minor infections. They don't really cause too much of an issue. More often than not, it is because parents have been over enthusiastic by trying to constantly clean the ear, use earbuds, etc., which, mind you, should never be used at any age group. Okay, so they can cause a little bit of dryness, they can cause a little trauma, and that can develop an outer ear infection. But largely, if you've got an outer ear infection, it can be long term. But the only way you will know whether it is long term or not is by monitoring the child. So you will have to treat the child, see whether the child is improved. Number one, subjectively, that means parents will notice how the child is reacting, and number two, objectively. So you can do a follow-up audiometry test or a follow-up hearing test and identify that, oh, now the child seems to be doing well. Right? So that's essentially what you would do to understand. Now, there are no differences between a long term and a short term. The hearing loss is either 10% or 40% or 70%. So those will be the same. It is just that the root cause will be different in different children.
Are there any advancement or emerging technologies in the field of pediatric audiology that parents should be aware of?
Right. So when we talk about emerging technologies, it's either in the diagnosis or in the treatment. So when we're talking about diagnosis, over the last decade or so, a lot of the older technologies have now become very foolproof. They've become very minimally invasive, and children are often tested. So now we're able to pick up problems earlier rather than later. The types of audiometries are largely the same. What has changed is that often we would also be able to do imaging in the form of getting a CT or an MRI scan done for a child to understand whether there is a very specific structural or anatomical problem. The other thing, especially in very young kids, would be to do some form of genetic testing, which can be done when we are suspecting a syndromic problem. That means a syndrome is a group of different problems. So if you've noticed that the child is, well, not hearing well, but also the child is a little slow on a few of the other milestones, then you definitely want to look for certain other possible causes, and sometimes there is an indication to do genetic testing. It's the treatment which really is important, and there are two types of relatively new technologies. I wouldn't call them outright new because they've been now around for a while, but they're still not very accessible, especially in the Indian context, partly because lack of awareness and partly because of some amount of financial or cost issues, because a lot of these technologies can be a little expensive. But if you know for a fact that the child has got hearing loss at the age of 1 or 2, has tried a hearing aid and doesn't seem to be benefiting from the use of a hearing aid, then the use of a surgery, something called a cochlear implant surgery, is very helpful. And this is a procedure wherein we actually implant or do a surgical implant of a device which has an electrode which goes into the inner ear and stimulates the nerve of hearing directly. And it also has a section externally, just underneath the skin, which will actually capture the sound and convert it into electrical energy. So these are the two parts which will actually be life-changing for kids.
So the last question is the treatment of hearing loss in young children is different from adults? What do we do to treat it?
The short answer is no. There is no difference. Our ear function is the same, so primary treatment has to be the same. It is just that the type of problems that we see could be a little bit different in kids and a little bit different in adults. Now that said, our general approach might be a little different. For example, if you've got a child with hearing loss at the age of 2 versus if you've got a 65-year-old who starts getting significant hearing loss, I may not immediately suggest to use a hearing aid for a 65-year-old because they probably can hear, they just don't hear as well. But if you've got a 2-year-old who is not hearing, it will be life-changing. You will not be able to develop language, develop speech. social interactions will not happen. So there are a variety of different areas where milestones will start lagging and the child will not grow. And such childs become depressed, they don't interact with people, and then they kind of get left behind. So these are patients in whom we would immediately take care of the problem. So the first thing that is different is that our approach has to be a lot more aggressive when we are dealing with hearing issues. The second is that secretory or acute otitis media, that means collection of the fluid, is one of the things which is fairly common in children. We don't see it that often in adults. And that may require a very minor surgical procedure. It's extremely minor. It's a 4-hour stay in the hospital or 6-hour stay in the hospital, and kids don't really have any major restrictions after that. So technically it can be done very easily. But again, for all the same reasons, we want the child to keep on hearing. We don't want to sit on it. It's not like we'll operate immediately. Often we'll wait for a few weeks, even a month or two. But if we can consistently see that the child is not responding, then that's something we would ignore. Also, cochlear implant surgeries traditionally have been done more commonly in young children, although there is now more and more indications to use it in very old people who really can't hear with a hearing aid at all. But a lot of such adults are able to use a hearing aid and work well with it, but often children are not. So there are certain diagnostic criteria or guidelines based on which, or protocols based on which we say so and so child should undergo a cochlear implant surgery, or so and so child is doing well, we should probably continue with a hearing aid.
Thank you, sir, for your time and your valuable insight. Thank you, VS, for spending time, and you can leave your comments that we are able to answer your queries.
Thank you.